Okay, so making a pre-scrotal incision, I like to start with the left testicle. Just go ahead and push it on up. Try and make a full thickness incision. And then you see if you can squeeze it out through a tiny opening. If not, you can always make it bigger. And the patient is not a big fan of this. Sorry, Silas. Alrighty, and this one is an adult, so he's got quite a bit of fascia, quite a bit of tissue. And so I'm just holding it at the base on the caudal aspect, trying to get some of that tissue out of here. He's a tough one. Gotta put my back into it. There we go. And then I'm just gonna strip that down. And then I like to make 2 encirclings, and I just go ahead and flash it a little bit. And he's not a fan, so we're gonna let him think about it. He's thinking about it, he just don't like it. So I'm going to start with my encirclings. I usually don't have to do a surgeon's throw. And this is the closed technique, keeping that tunic closed. Oftentimes with big dogs that are adults, I'll do the open technique, which really isn't hard. It's not much different. One encircling, going for encircling number 2. And I like to just line it up really good so I can put that encircling right where I flashed it. Just to kind of crush some of those tissues, make sure I get a good hold with the suture. And then that is it for that one. And it's a good idea to hold on to it, especially in the beginning. What you'll come to find is those pedicles, they don't tend to really go anywhere, so I'm just going to cut it, and we're going to look at it. Looks great. Shove it back in its home, and go towards the other side. And so you'll just push up that right testicle, urethra, everything. The bone is over there. Just going to cut through some of that fascia. Still look okay? Pop it on out. Am I in the way? Yeah?
Just kind of your hands.
Yeah, you might do it from another perspective.
Like
right?
now I can see. Yeah, like when you first,
When
I'm
I'm
trying to
trying-
pop the testicle, you can't see.
Oh, okay. Trying to put my back into it. And sometimes you'll get little bits of fascia. We're going to get rid of that in a second. We don't care about that. Go around again. Get our second encircling. I pretty much always do 2 encirclings on my neuters, even when they're babies. I know some people that'll do 1, Miller's or a modified Miller's or something like that, if it's a really small one, if they feel good about it. I just don't trust male dogs, I guess, so I always put 2 on. Looks good. Send it home. I'm gonna get rid of this little bit of fascia. We don't care about you. And then we're gonna suture it up, and really it doesn't take more than just a couple sutures, but I'm gonna start with my buried subcutaneous, deep to superficial, superficial to deep. And I got a long tail, I don't need that, we're gonna get rid of it. Pull it parallel to your incision in order to bury it. And And then I like to do my little hemostat trick to keep it out the way. And this isn't a big incision, so it's just going to require a couple little subcutaneous. Actually, I might even just end it there. I'm going to find my deep layer. I like to hold on to it with a pinky. Although, let's get it straight. And then now I'm going to finish with doing a superficial to deep on one side, superficial to deep on the other. Do an Aberdeen knot. Pull it through. Looks a little ugly right now. That's okay. Sometimes that happens on these guys. And then I'm going to start the dermis. And Stacy, you can turn him off, Sibo.
Okay.
I try not to touch that skin as much as I can, and when I do touch it, it's just kind of a gentle little grab. Not trying to crush that tissue. I just want to make sure that I just get dermis. And I'm not traumatizing it. And now I'm just going to bury it. So I'm starting superficial, ending deep, tie it off, and we're done. And we're going to smurf it at the end just to try and make it look pretty. You can add some tissue glue if you like. I tend not to, again, trust male dogs, so I'll put some tissue glue on it even though it looks really good.